How to take prednisone without feeling awful. Prednisone causes more side effects than any other drug. So if you've been prescribed prednisone and you're wondering how to take it without feeling so awful, then you're in the right place. I'm Dr. Megan, the Prednisone Pharmacist. And I'm not only a pharmacist, but I'm also a board certified doctor of pharmacy, third generation pharmacist. And I personally had to take prednisone for 9 months. So I understand how it feels. And in this video, I'm going to teach you exactly how to take prednisone the right way to avoid the top 3 prednisone mistakes people make when taking prednisone, to avoid some of the worst side effects. So the first mistake people make is taking prednisone at the wrong time. That leads to the number 1 tweeted side effect, insomnia. People are experiencing insomnia probably because they're either taking a super high dose or taking prednisone too late in the day. It's actually very best to take prednisone very first thing in the morning. As in, you put the bottle of prednisone on your bedside table with a cup of water, and you take the pill or pills, all of the pills, all at once first thing in the morning. That's it. 1 swallow of all the pills that your doctor's prescribing for the day with some water, and then go eat a healthy breakfast. That is the best way to take it, because then you're taking prednisone the way it should be to mimic cortisol, which is how it works in your body. Cortisol normally is high right before you wake up, but you can't take a pill before you wake up. So the earliest possible time you could take it is first thing in the morning. So take it then, and that'll help prevent the number 1 tweeted side effect, insomnia. The second mistake is not taking precautions to protect your bones. A lot of people aren't aware, and in fact, most doctors fail to warn people that prednisone is the number 1 drug that causes osteoporosis. And another myth is that that's going to happen long term. Not true. The biggest bone loss happens in the first 12 weeks of treatment. So you need to be following the guidelines of the doctors who prescribe prednisone the most. In these guidelines, they teach exactly what you need to do. So in addition to getting exercise, quitting smoking, and quitting drinking, they recommend optimizing your intake of both calcium and vitamin D. I'd recommend to go a little further and make sure that's vitamin D3 and that you're also optimizing vitamin K2 and magnesium, because then you're getting your body the full cocktail of nutrients needed to get that calcium to the bone and not to your arteries where it could harden your arteries. And this is exactly why I include those in my supplement called Nutranize Zone. It's the first and only supplement for people taking prednisone, and it meets that guideline. And not only does it help support your bones, it also helps you support other side effects. Like, for example, it's giving back the nutrients that are leading to weight gain, diabetes, and hunger cravings. But at the very least, even if you don't get my supplement, be sure you're supplementing with calcium and vitamin D to meet this guideline. The number 3 mistake people are making is not tapering correctly. Some people are going cold turkey, stopping the medication before the doctor says. That's awful. And others are struggling to taper off properly and are going through withdrawal symptoms. We don't want to have either of those situations. So in addition to following what your doctor says and working closely with them to communicate your symptoms, I highly recommend doing this for yourself. Following a taper chart where you can fill in the blanks of how you're feeling at that dose. So for example, at 7 milligrams, I was getting relief from my pain, but I was also experiencing this side effect. At 20 milligrams, I was having awful insomnia, things like that, so that you and your doctor can work together closely to get you on the best dose and the proper taper for your body. Because prednisone mimics cortisol, which affects up to 2/3 of the genes in your body. So every single person is different in how you'll experience prednisone and the side effects. Next, a bonus tip. This is that there are some things you need to avoid while taking prednisone. And I have a video coming up next that you need to watch that goes through the 7 or more things that you need to avoid while taking prednisone. Just click or tap to move on to this video that's had over 100,000 views. It's exactly what you need to do to avoid the mistakes that you can make while taking prednisone. I only went through 3 mistakes. This goes through 7 or more things that you need to avoid. That's a lot of mistakes that are possible. Just watch that video next. Signing off is Dr. Megan, your prednisone pharmacist.